requirement that needs to be fulfilled during this family medicine posting. Next, you are going to be shown with a role play featuring a new mother with a 5-week-old baby who is concerned with worries concerning having trouble with breastfeeding.
Hi.
Hi, good morning.
Hey, doctor.
Good morning, Miss. May I know your name, please?
My name is Mrs. Rani.
Or Mrs. Rani. I'm June. I'm your attending physician today. So may I know your age, please?
I am 35 years old this year.
Okay, I see. How about your occupation?
I work as a housewife.
Okay. Then how about where do you stay actually?
I'm stay at Switzerland with my families and with my husband lah.
Your husband lah. Oh, I see. Okay. So you're married with your husband lah. Okay. So how may I help you today?
The thing is, I am new mother with a 5-week-old baby. Recently, my nipples are very sore and cracked, and I am unable to breastfeed. I say painful for me, and it also does not relieve, even though after I add cream, which I bought from the pharmacies. I really wish I can breastfeed as I look through the internet on the breastfeeding because I really wanted as a mother to look my baby to grow up healthy, and I really want to give the best for my child. What can I do, doctor?
I see. I'm really sorry to hear that. However, I'll try to help. I will really try my best to help your situation lah. So can you elaborate more on how the breastfeeding goes so that I can understand more about your situation?
It's not going well because it doesn't go as I expected. Especially when I'm breastfeeding my baby seems to fight the breast during the breastfeeding.
Actually, I don't understand. Like, how do you mean by your baby is fighting the breast?
I mean, like,
can you please elaborate more?
He turns his head away from me and crying during breastfeeding. Like I saw that his mom is struggling to hold the nipples and it really getting me down. Like everything was beyond my expectation. It was really like I'm feeling like I'm not enough to be a good mother for my baby.
I see. So is this situation occurs during all the breastfeeding over the past few weeks?
Actually, it was fine until recently. I don't know. It's so difficult for me to cope alone. All this time I've been proud of myself for being capable. I'm being an independent woman with a stable job in professional field just before my baby was born. And I imagined that being a mother will be wonderful for me. And it's never crossed into my mind that this will become a disaster when it's bringing down my self-esteem.
Oh, I see. I'm really sorry to hear that. I understand your current feelings, Mrs. Rani. Actually, I don't understand by what you mean by alone when you say it's difficult for you to cope alone. Actually, where is your family members? Can't they help you, or they aren't fit, or is there any other situation?
My husband is working, and the one I can rely on is my mother. But in this situation, she's not being helpful. She said I could just bottle feed and save all the bottles where she suggested to use the suction, and then I think her idea is not supporting me because for me I want to have the bond with my baby. But in the other side, sometimes my husband help me to feed my baby at night, but he has to work for long hours during the day and he's not always there for me whenever I need him. But I'm being an understanding wife, which I cannot bother him with all my own stuff.
Yeah, that's really sad, right? I wish I can help you at the time also. So, how do you actually feel when you're unable to breastfeed the baby?
I feel like I'm not being enough. Like I'm not being good mother because whenever I try to add formulated with milk, I think my breast milk is not enough. I think my body is not doing enough for me to breastfeed my child because it's like normal for a mother to see her baby like growing healthy and and there goes the bonding between the mother and the child. And also I got thanks due to all this problem.
I see. Mrs. Rani, actually, you can try to calm down first before I explain further on your situation. Try to relax first. Don't worry, I'll try my best to help your situation lah. So from what you told me just now, I think you're having what we call a mastitis, which is the inflammation of your breast. So this is common. Actually, this is actually common among all the women that is breastfeeding, and it occurs when the breast does not empty enough completely. Your breast is like dark, and when it don't empties enough during breastfeeding, it will lead to blockage. So this blocked milk duct will actually cause the bacteria to enter into your breast through the crack in the skin of the nipple or through the milk duct opening. So this is where the inflammation of your breast occurs. So do you understand what I'm trying to tell you here?
Okay, I'll try to digest it bit by bit. But now, what do you think I can do for now?
So for now, I think we will plan an ultrasound for you for your breast to rule out any much more sinister causes of breast pain, such as it can be breast abscess. You know, when the bacteria form, the bacteria and your immune system try to form one lump in your breast, and it can be really painful and also may cause similar symptoms to your condition. So we try to rule that out, and I would also like to take a culture of your breast milk to see what kind of bacterial infection you actually have.
Will it be painful?
This bacterial infection will going to guide me on how to prescribe the correct antibiotic for you. So I will also prescribe an antibiotic for you for your condition. And is there any more question?
Regarding that, all those things you said just now, will it be painful for me?
I think you can still continue to breastfeed. However, due to your condition, it may not resolve after a few days. And if you really think that your breast is still painful, you can come back and find me again. Don't worry, Mrs. Rani. I will try my best to help you until you are recovered.
Okay.
That's all. Is there any more questions?
I think that thank you. It really helps.
Yes, you can go line up and take out your prescription medication. So that's all. Mrs. Rani, thank you very much for coming today, and thank you for seeing me today. Okay, thank you.
Thank you.